Irving, if you could tell us a little bit about what MedTalks is for all of our first timers here.
Sure. So MedTalks is designed to help educate the general public about a range of issues involving medicine and healthcare. This is inspired largely due to the current health climate and the widespread misinformation out there. And not only is this tremendously misleading, it's often promoting dangerous and unproven treatments that could put your health and your lives at risk. So creating this program was our attempt at fighting this dangerous trend and helping people get the real facts.
Thank you for that. Dr. Ding, can you tell us why women's health is such an important topic to discuss with our community today?
So there's actually an interesting disparity in the cost of treating women versus men. So during the ages of 18 to 44, health spending for females is estimated to be almost 84%, or roughly $1,800 more per year compared to men. From age 44 to 64, spending for women is roughly 24% higher. And then even beyond that, age 65, the spending is still higher than that for men. So research has shown that over the course of a woman's adult life, estimated out-of-pocket costs for routine screening, birth control, feminine hygiene products, pregnancy care, and childbirth, that coupled with lost wages, the price tag adds up to almost $154,000 over the woman's adult life. And these high costs, coupled with confusing laws and large amounts of misinformation out there, can create a real challenge for women to make the best choices about their health. And so with that, I would like to introduce our guest speaker. We have Dr. Kevin Phung, who's an OB obstetrician, gynecologist, and clinical professor at the LA County and USC Medical Center.
Welcome, Dr. Phung.
Hi, thank you so much, Lynn and Irving. It's a pleasure to be here. Like Dr. Dang said, I work at LAC USC Medical Center. I'm a professor at Keck School of Medicine, and I'm also, I guess, a SoCal native, grew up in Orange County. So I'm happy to talk today about women's health, and we're just going to get started since I do have another meeting at 5, but I hope that we can get through some questions. I want to give you some background. For me, this is a picture of me when I started at USC. I was born to 2 Vietnamese refugee parents in Detroit, Michigan. That's where my dad went to residency at Wayne State, and I'm the youngest of 4 children. This is a picture of me. I don't know how old I was, but that's me growing up. I grew up in Orange County and went to Laguna Hills High School, graduated in 2003. And from 2003 to 2007, I went to UC Berkeley. This is a picture of me speaking at the Southeast Asian graduation. And I was also part of the collegiate taekwondo team, in which we were collegiate champions for 2 years I was on there. And then I got into my dream med school at UCSF in San Francisco. This is a picture of me and my dad on my very first day of school. It's called the White Coat Ceremony. And then a picture of my sister and me graduating 4 years later in 2012. And then I did something called internship. This is where you have to kind of get like assigned to a hospital. It's almost like the military draft in a way. You get assigned to a base, and for me, that was in Dallas, Texas. It's actually the largest labor and delivery in the country and the largest OB program in the country. And they average 33 deliveries a day there, which is a lot. I then finished my residency at UC San Diego from 2013 and 2016. This is my brother. He's 2 years older than me, but we were both at San Diego at the same time. So it was a lot of fun working with him in the same clinic, and we had matching IDs as well. And then this is a picture of my 4 siblings that I had mentioned earlier at my graduation, and a picture of my mom during my graduation. They reserved a parking spot for me. I've never had a reserved parking spot before. And then when I graduated in 2016, I took a job at USC as faculty here, and it's been really the like most meaningful part of my life is actually working with medical students. So this is here with my parents after winning a teaching award, and they came for the ceremony. So what do I do now mostly? Like I had mentioned, I actually do mostly medical education. For 50% of my time, I am teaching, mentoring, and advising here I'm teaching students how to do a dilation and curettage procedure where you suck out the seeds from a papaya. It's very similar when you do that on a uterus. And then this is a group of students. All these students are interested in OBGYN. And actually, we're a very needed field. Actually, the national estimates is that there's about 8,800 less OBGYNs than we need in this country right now. And 50% of all counties don't even have one single OBGYN in them. That's how bad. And less than 50% of women live within 30 minutes of their of a hospital that can deliver them. And you know, you don't need to be a doctor to know that you don't want to be driving more than an hour when you're in labor. It's not safe for the mom or for the baby. So we need more people in it, and that's kind of what my life work is to foster people who want to go into OBGYN. My clinical specialty is in minimally invasive surgery. So I do something called laparoscopic surgery, where we do surgery through small holes in the belly instead of having large incisions, and people can actually go home the same day instead of staying multiple nights in the hospital. And versus a normal surgery where you go back to work in 6 to 8 weeks, after a surgery with me, you can go back to work in 2 weeks, which you might not want to do. Maybe you want to stay home longer, but at least I can get you home if you want to. And then lately I've been doing a lot more robotic surgery, and this is kind of the future. The robot was just invented in 2006. So it's, I'm lucky I'm young because I know how to use it. And maybe it's all the video games I played growing up, but it's actually pretty incredible. And we're able to do stuff that they didn't think was possible. And on the right is my mentor from Austin, Texas. His name is Dr. Garza. He's one of the grandfathers of robotic surgery. And he taught me how to cut cow tongue out of a belly button. So that's what we were doing right there. I also do obstetrics, and that's the child care and care of pregnant women. And this is a picture of a baby that was literally just born, probably a minute before this picture was taken. And that's a picture of me smiling at the camera. Okay, so let's talk a little bit about the OBGYN and why you need to go in for your annual exam. So I don't know if many people know, but OBGYNs are also considered primary care. So if you don't have a primary care doctor and you are looking for one, and you happen to have reproductive needs or a woman, then consider picking an OBGYN because it's kind of a one-stop shop. Best treatment for disease is preventing disease. So what we do, even if you don't have anything wrong with you per se, it's important to be seen. And this is something that men don't have like an annual exam. And that's why men delay care so much. And they don't come in until their chest hurts and they're 50. And then you find out that you have clogged arteries or you're at risk for a heart attack. And that's what you want to prevent. So women's health is a little bit more complicated, but the good side of that is that because they need to get plugged in earlier, we can prevent disease earlier. So what do? We screen for cancer, breast cancer and cervical cancer. And breast cancer is ridiculously common. 1 in 8 women will get breast cancer in their lives. That's a really, really high number. And I'm sure you know more than 8 women in your life. So the fact that one of those women will get breast cancer in their lifetime means that we need to be screening for this because if you catch it early, you can prevent it or you can treat it. Vaccinations. So we do routine vaccinations as OBGYNs. HPV, which I'm going to do a in-depth talk about after this. Tdap, which is for tetanus, diphtheria, whooping cough, shingles, and flu vaccine, which you should get every year. We do birth control. So I'm going to talk about all the different methods of birth control, but just as a preview, there's a lot of different ways depending on what works for you. If you don't remember to take pills, then we can give you an injection that lasts 3 months. If you don't like injections, then we can give you something that will last you 5 years to 7 years. So a lot of things to think about. If you have any issues with your menstrual period, or maybe you have a daughter that hasn't had their period yet and they're 16, this is definitely something you want to have checked out because it could be an issue that's underlying with your hormonal system. Sexually transmitted infections. This is really important, and I'm going to do a whole slide on this after, but we screen for it routinely and also counsel people on it if you think you've had exposure. If you have any concerns about sex in general, sexual dysfunction, urinary incontinence, you know, I have a lot of patients that they just figured they were old and that sex was supposed to hurt, and when in reality they had a condition, or they were lacking a certain hormone. So talk about it. It's definitely, it's probably not just you, and there's probably a lot of people that have the same issues that you do, and you might be able to fix it, and it might actually be important to your relationship. So this is something that we talk about that maybe the other doctors don't. So something to always bring up. And the incontinence issue, yeah, that's something that can affect your life if you can't, you know, leave the house without being worried about going to the bathroom when you can't control it. So that's something that we have treatments for as well. And obviously, if you are thinking about getting pregnant, you should probably talk to an OBGYN, because not everybody is in the same physical fitness to become pregnant. It's a very taxing period to go through if you are pregnant. So you want to make sure, if you have issues like high blood pressure or diabetes, that you talk to your OBGYN about it. Or if you have fertility issues, you've been trying to have kids for more than a year, you should definitely talk to us. If it's been more than 6 months and you're close to 35, you should also talk to us. Then we also screen for normal things that your primary care doctor, your general practitioner would do. Diabetes, osteoporosis, which is a big deal, blood pressures, cholesterol, and depression. And for our listeners there, or if you have parents or aunts and uncles, you know, osteoporosis, breaking a hip is actually more common than getting breast cancer. 1 out of 6 women are gonna break a hip in their lifetime, and that's incredibly high. And if you know anybody that's ever broken a hip, it's incredibly difficult to recover from. So you definitely want to be taking calcium and vitamin D supplements if you aren't, and doing weight-bearing exercises 3 times a week. It's one way to reduce your risk of breaking a bone by 50% if you do those things. So here is a kind of a pictorial representation of everything I just talked about, everything that we can do for you. I'm going to go into depth into 3 of these sections, but really, there's really nothing that you can't tell us that we can't at least give you some counseling on or direct you to the right place. But birth control, cancer, sexually transmitted infection, these are all things that I'm about to go into. So what about how old, what age do I really start to need to engage in care? What kind of screenings are important based off of the age that I am? So first visit actually should be between the ages of 13 and 15. And the reason why is because we do a lot of things here. One, a lot of people are starting to have their periods, but this is also an important time to talk to people about alcohol, substance abuse. It's screening for that abuse. We screen for depression. We screen for blood pressure issues, because a lot of young people, and I don't know if you've ever heard stories of like track star, well, you know, everything was fine, and then suddenly they are in the middle of practice and they drop and they are unconscious, and it turns out they had a heart condition. We could have screened for that, because abnormal blood pressures would have indicated to us that something was wrong. So you need to get plugged in. You got to get plugged in early. And also it's because people are having sex at that age. Teens are having sex at that age. So the idea of just ignoring it doesn't actually reduce the risk, doesn't reduce it to happening. It actually just puts those children in bigger danger. So if we counsel them on it, maybe they can actually avoid it and we don't have to treat their infection. But if you just don't talk about it, it's going to happen underneath your nose. So this is also when we would vaccinate for the HPV vaccine to prevent cervical cancer. I'm talking about that in just a little bit. If you're age 21 to 65, you need to be getting your pap smear. Okay, so pap smear is actually a screening for cervical cancer. All we do is rub a little brush on your cervix, and test the cells. And if the cells look like they are precancerous, then we have treatments for that. But actually, cervical cancer used to be a very big problem in America, and it's still the 4th biggest cancer in the world. And I'll talk to you about that in a second. But why did it go down? Because of Pap smears. And it's been considered the most successful cancer screening program in all of medicine. If you're age 40, this is when you have to start getting your mammograms, right? Every 1 to 2 years, you should be getting a mammogram. Shout out to my dad, who's a radiologist in Westminster. You can get mammograms from Dr. Phung in Magnolia Imaging Clinic. I know that's where my whole family goes and gets their mammograms. So you need to do it. Like I said, 1 in 8. That's a very common number, right? So you need to get it, and we can prevent advanced breast cancer if you catch it early. Age 50. This is when it's important to start getting your colonoscopy. Now, this doesn't sound like a very fun thing to get, but I will tell you that you're asleep, so it doesn't really matter. 2, it lasts 10 years. So really, you only need to get it like 3 times, and then you're done. And if you don't want the actual colonoscopy, there's alternatives. You can do a CT colonoscopy where they just image it, and you can do that every 5 years or so. I think my dad also does that. He didn't know I was going to plug him, but he does that too. Okay, so age 65, bone health. And if you actually have risk factors for poor bone health, let's say you go into menopause early, or some other reasons, if you're on steroids, your bone health is going to be a lot worse than normal, and you're going to be at risk for bone fractures. So osteoporosis is when you start getting what's called fragility fractures. So you get fractures when you're not supposed to get fractures. So if somebody gives you a high five too hard and you break your hand, that's a fragility fracture, and that means that you're at risk for breaking something more important like your spine or your hip. And my grandma actually had a vertebral fracture for this reason. So you want to get your DEXA scan. A DEXA scan is just an X-ray. My dad also does these scans, just FYI. Okay, so let's talk about the HPV vaccine, okay? So this is really important because you know so much about this virus, human papilloma virus. We understand it so well, and this is one of the cancers that we understand almost completely. Some cancers we don't even know why they happen, but we do know how HPV causes cancer. And it is responsible for not only cervical cancer and genital warts, it's also responsible for a lot of throat cancers and anal cancer as well. Just 3 years ago, we had almost 13,000 new cases of cervical cancer in the US. And like I said, we're one of the best countries in the world. And you still have about 13,000 women getting cancer each year in this country. It's the 4th most common cancer in the world for women. And over 300,000 women die a year from cervical cancer, which is a shame because we know how to prevent it. So it's transmitted through skin-to-skin contact. That includes sex, but it's not only sex. Because like I said, you could have HPV on your genitals from genital warts, on your vulva. So skin-to-skin contact with those lesions will spread it to you, right? So it's not just a sexually transmitted infection. And I mentioned that because a lot of parents are like, my 13-year-old is not going to have sex. Why am I going to give them a vaccine? And that's a very misinformed statement. It's not just sex. In fact, 50% of women who have not had sex will have HPV. So it's before their first sexual encounter, if intercourse. And actually, it's so common that by the age 50, 80% of people will have HPV, right? So everybody has it, but it doesn't mean that we can't stop it. Condoms help, but like I talked about, it's not everything because the condom doesn't cover your whole vulva or your whole perineum. The skin is not completely protected. So, and the worst part about this is that you might not have any symptoms. Guys definitely don't have any symptoms unless they have genital warts, but it's an invisible disease. So that makes it even more important to not only get your pap smear, but actually get vaccinated. A lot of people will fight the virus off themselves, so that's great. That's great news. But as you can tell, a lot of women don't fight it off. A lot of people don't fight it off. And 20%, up to 20% will not clear the disease, and in which case that advances to cancer. It takes about 20 to 25 years to advance to cancer. And that's nice because we have that time to catch it. But if you get HPV when you're 13, guess what? 20 years later, you're 33. You don't want to be a 33-year-old with cancer when it could have been preventable. This is a picture here of the female reproductive tract. Just in case people are wondering, like the cervix, I don't even understand that. At the end of the vagina, the vaginal canal, the vagina meets the uterus, and the mouth of the uterus is called the cervix. It's what keeps the baby in when the baby is growing inside the womb. Okay, and then the uterus is connected to the ovaries and the fallopian tubes. That's how the eggs from your ovaries reach the womb and get it implanted. Let's talk about the vaccine. So Gardasil is probably what you've heard. That's the brand name. Gardasil 9 is kind of an updated version with more different types of HPV that it covers, and Cervarix. Did you know that this is the only vaccine that is known to prevent cancer? Other things like prevent the flu or prevent, odd diseases like polio. This actually prevents cancer, and I think that can't be understated. If there were any other, if there were a vaccine to prevent lung cancer, would you get it? Probably. If there was a vaccine to prevent skin cancer, would you get it? I would. Yeah. So this is one of those things that it shouldn't be controversial. It's a no-brainer for me. So also bonus, if you don't want genital warts, guess what? These also cover genital warts. That's kind of a nice bonus. Don't need those ruining your life. And this is also very, 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 very safe. So who should get it and when? So it's recommended that you get it at age 11 or 12. You want to get it before the first sexual activity. You can get it as early as 9 years old. You want to get it before if you can, but even if you don't get it before, it's still good, because even if you got infected with one type of HPV, it might not be the high-risk HPV that causes the most likely to cause cancer. Those are subtypes 16 and 18. They're like the bad guys, right? But if you've already started having sex and you're like, oh, is it too late for me? The answer is no. It's not too late. It's only going to help. And like I said, it actually might prevent some of the worst strains of HPV from infecting you and your partner. The CDC recommends that men and women up to age 26 all get it. Everybody, men and women. Why men? Because men are the ones that are primarily spreading it, right? So it lives on the tip of the penis, right? And it also lives in both the oral cavities and the anal cavities, right? So men actually get throat cancer from HPV. Men get anal cancer from HPV. Men get genital warts from HPV. And then they spread it to their partners and their wives and their loved ones. So why aren't you getting it? You should. It's actually recommended by the CDC in the United States. And in fact, FDA approved it up to age 45. So if you're less than 45 and you're listening to this talk, you should go talk to your doctor about getting Gardasil. Because why not? How many shots is it? 2 shots if you're under 15, and 3 shots if you're above 15. 1 shot's better than nothing. It's over 6 months, so we usually space it out. But it's fine. It's a shot in the arm. Take a Motrin afterwards, it'll be okay. All right, let's talk about STDs, STIs. So, we used to call them STDs, but you know, people don't like to think that they have diseases, right? Infections are things you get and you can treat them. Diseases are like kind of a chronic thing that you can't get rid of sometimes, right? So we renamed it. Sexually transmitted infections, a little bit less stigma to that. This is a major public health issue. It doesn't matter if you're rich or poor. STDs happens to everybody, and it's very silent, and nobody likes to talk about it. But this is one of those things that you can't be lax on, because this can affect you in a lot of ways that you might not even really appreciate, and a lot of the time you don't even know you have it. So if you leave it untreated, and especially for women, it could lead to something called ectopic pregnancy. So chlamydia is known, I'm going to go over some of these in a little bit, but chlamydia is the worst one. It's the most common STI. And what it does is that it causes damage and scarring all along your fallopian tubes, the tubes that connect your eggs from your ovaries to your womb. And if those tubes are all scarred up and not working, then the egg doesn't leave the tube. And then when the sperm goes to fertilize the egg, it's not in the womb, it's in the tube. And when it fertilizes in the tube and it starts growing and thinking everything's normal, it hits a certain size and it explodes. And then the person who has that ectopic pregnancy bleeds from that site and actually is at risk of dying. It's an emergency. If that happens to you, we often have to do surgery on you or give you a medicine that's a chemotherapy agent to stop the ectopic pregnancy from growing. It's a very serious issue. And one of the #1 reasons to get an ectopic pregnancy is a history of sexually transmitted infection. It can actually scar up your tube so bad that you can become infertile. It can also cause chronic pelvic pain because of the scarring that it causes all along your pelvis, and also causes scarring along your liver because the infection spreads all around your abdomen. And then it also, sexually transmitted infections can cause hepatitis, liver cirrhosis, and liver cancer. You definitely don't want to be messing around with that, let alone HIV and AIDS. So what do we test for? We test for gonorrhea and chlamydia, like I talked about. We test for syphilis, and you probably don't know. You can like kind of look all these diseases up. They're both gross and fun and informative. Syphilis, believe it or not, if you leave it untreated, it travels to your brain and makes you insane. And a lot of, actually one of a famous OBGYN back in the 1800s, they didn't have gloves back then. And he died from tertiary syphilis because it infected his brain. It's kind of too bad. But he was like in the trenches, you know? So HIV, well known, you know, like, but preventable. Hepatitis B and C, very prominent in the Asian American community, hepatitis B, right? And it's spread bloodborne, and it's spread sexually. And so if you haven't been vaccinated for hepatitis B, do it. It's such an easy way to prevent liver cirrhosis and liver cancer. And trichomonas. Trichomonas is actually the most common protozoan sexually transmitted infection. And it causes inflammation and a really weird discharge. That's also kind of gross, but you should learn about it so that you don't find out the hard way what it is. And we don't typically screen for herpes. Why? Because over half of adults have herpes. Yeah, surprise, you know? So it's important to actually know if you have a health scare, we can screen for it, or if you have a lesion, you don't know what it is, we can swab it. But it's kind of worthless to just screen everyone for herpes because we get a lot of positives for that. But what's important to know, especially for the women out there, is if you have a history of genital herpes, herpes around the waist, you need to tell us. This is not a secret you need to keep, because if you have a pregnancy and you don't tell us about the herpes that you have genitally, and that baby goes through that birth canal, it can infect the baby right when it's born. And then that herpes can actually infect the baby's eyes and give it blindness. So you don't want to give a newborn herpes as its first birthday present, right? So let us know. We can actually suppress the herpes so you can deliver vaginally. But if you don't let us know and we find herpes at the time of your delivery, you're forced to have a C-section. We won't let you deliver vaginally. America is doing really poorly. That might not be a shock to many people, but it's not helpful that we're not talking about it. So we've had a 76% increase over a 4-year period of the number of cases of syphilis. And we've had a 67% increase of gonorrhea. And in fact, the most common condition reported to the CDC, chlamydia, 1.7 million people getting it in 1 year. We're doing it wrong. People are not doing a good job, right? People aren't practicing safe sex. People aren't getting tested. People aren't talking about it. People aren't holding their partners accountable, right? Don't take their word for it. I want to see the damn lab results, right? Show me a negative. You know what? You can test for gonorrhea, chlamydia in a urine test. No excuses. You can do a urine test and test for all this stuff. So go get checked out. And it's really easy. You can go to a public health department and they'll do it for free. So you should be tested. Depends on your age and if you're increased risk. So let me tell you what the CDC considers increased risk, okay? And you don't have to raise your hand, but I bet you might fit into one of these. All right, having multiple current partners, that's obvious, right? But you're high risk and you should be getting screened more regularly. Having a new partner, right? So even if you have a new partner, you're suddenly increased risk for STDs. You should be getting tested. If your new sex partner has multiple partners, that seems pretty obvious, but maybe a difficult conversation to have. But you know what's more difficult than having a conversation? Dealing with gonorrhea, chlamydia, and HIV. That's a lot more difficult than having a conversation. Using condoms inconsistently, especially when you don't know the status of your partners. Right? If you're gonna not use protective barrier protection, then they need to show you a lab slip that tells them that they're cleared. Having sex while under the influence of alcohols or drugs. I'm sure no one's ever done that here, right? Guess what? That puts you in a high risk category. So you would qualify for increased screening under that. Having sex in exchange for money or drugs, okay? Having a history of STIs. So, and if you are men having sex with men, high increased risk for STIs. And guess what? Here, what do I have here? Do you know that 50% of people under the age of 25 are gonna have an STI if they're sexually active? That's a bad coin flip. You're gonna risk your future fertility or like chronic pelvic pain for the rest of your life on a coin flip of whether your partner has an STI or not? That's crazy. That's a risk that you don't want to take. You should verify that. I have a saying, trust but verify. You can trust people, but make sure you verify that they're telling you the truth. So if you're less than 25, we consider you high risk. We don't care what you tell us. We don't believe you. And that's just because we know better. And so you should be treated annually. If we see you, we're gonna test you annually. And that's what the data show. So you just have to kind of know that you guys are the highest risk, right? It's like 16-year-olds and driving. Like, yeah, I'm sure you're responsible, but you're also the highest risk. So we're not gonna like give you low insurance rates because we know better. If you're greater than 25, like I said, if you fall into any of those categories, we want you tested. New partner, you should be tested, right? Any of those categories. HIV, you should be tested at least once in your life. The CDC thinks that you should be tested, anybody between the ages, reproductive age, 14 to 65, or that age, not reproductive after 65, but that age group, it should be an opt-out, right? we offer it to you, and you can opt out, but everyone should get tested at least once, because you don't know. What if you got a blood transfusion and you had HIV in it? You know, we screen blood, but not every screening test is perfect. And so if you're walking around with HIV and never knew it, that would be really awful, because our treatments are so good now that you wouldn't even know that it's an issue. You take a pill a day and you're fine. When you're pregnant, it's a little bit of a different story. And we treat everybody in pregnancy. We test for everything because it's so catastrophic. If you have an STI and you pass that on to your baby, no, it's inexcusable. So we test for everything: gonorrhea, chlamydia, syphilis, HIV, hepatitis B. So that's why it's kind of nice. You know, a lot of people on here might be wondering, like, well, I don't have health insurance. Well, if you're under the age of 26, get on your parents' health insurance. It's free. Secondly, guess what? If you're under the age of 18, your health insurance is also free. California covers all minors. Actually, most states under Medicaid covers minors for free. You can apply for it. And if you are pregnant, no matter what your age, no matter your documented status, you qualify for emergency Medicaid. So we have, as a society, have decided that it's unethical to leave children and pregnant women and elders uninsured. But if you're between the ages of 18 and 65, you're kind of screwed. But if you're not, and you're or you're pregnant, you should sign up for health insurance right away. And we can take care of you from your first visit to your last visit, 6 weeks after your last visit. And while you're at it, we'll get you tuned up for everything else. We'll check your eyes, we'll check your heart, we'll check everything, because we might not see you again. We'll also screen you for cervical cancer. So like, this is kind of like your chance, and it's not gonna cost you a penny. And yeah, like I said, in most states, even in Texas. If you're concerned about an STD, we also will test you for trichomonas and hepatitis C, okay? There's treatments for hepatitis C now. It used to be an untreatable disease that led to liver cirrhosis, but we can actually treat it now. And the CDC actually recommends that if you were born before 1965, that we should treat you for it, because it used to be more common in blood transfusions and stuff to not screen for that. Trichomonas is, yeah, you can treat for that really easily. You need to make sure that we find it. And if you have any questions, you go to the website for your city's public health. It's free. Just go. They'll test you for it. All right, last thing I want to talk about: birth control and family planning. Okay, so here's a fun stat. 50% of all pregnancies in the US are unplanned and unintended. I will tell you that as the fourth child, that I was unplanned, and I'm very happy that my dad unplanned me. That's perfect. I'm glad that he didn't stop at 3, and I remind him of that very often. But what is important is that we make sure that you're doing it by your plan, right? Like, and when you go to your OBGYN, we want to provide non-judgmental counseling. We want to support you in your reproductive autonomy. We want to help you. We don't want to tell you what to do, but we also know if you're in school and you're studying for finals and you ain't trying to have a kid right now, like, then we can help you out, right? So you can't do it unless you talk to us. And if it's time for you, or let's say, you know, you don't want to have birth control, and if it happens, it happens, that's great. But at least we planned it out, right? At least we talked about it. So you want to talk to your provider about your options. And just to bust a misconception that birth controls are just for people that are sexually active or promiscuous, or whatever your label you want to put on that, that is a very misinformed statement, right? Because birth control has a lot of health benefits, has nothing to do with sex, has nothing to do with intercourse. The female, like I said, reproductive system is very complicated, which is why I've been in school for so long, and I'm still in school, going back to school. But if you have problems with painful cramping, heavy menstrual bleeding, right? You have hormonal issues, or you lack the, you have a mutation that makes it harder for you to clot blood, so you're bleeding a lot. Birth control can help you with that. If you're being treated for anemia, it might not even be related to anything women's health. You just have anemia. Maybe you have, you're a survivor of leukemia, and you have anemia from that. Your bone marrow doesn't make enough red blood cells because it was just hit with chemotherapy. Birth control can help with that, because you don't want to lose the blood that you're making every month. Pelvic pain. A lot of people that have pelvic pain have something called endometriosis. Endometriosis is this funny, weird disease where the inside lining of your uterus, the stuff that comes out during your period, is actually transplanted onto other parts of your body. It could end up in your lungs, can end up on your liver, it can end up anywhere. And every time you have your period, it causes pain. We can treat that. You don't need to live in that chronic pain. If you have bad acne, if you have abnormal hair growth around your chin, your chest, your belly, baldness, male pattern baldness, that could be an issue, a hormonal issue that can be treated with birth control very easily, actually. So, like I said, if you talk about it, it might not just be something that you need to hide. It might be something that we can treat. If you have issues with ovarian cysts, birth control can suppress that. So some people, not even knowing it, they have the tendency to grow cysts. And these cysts will grow and they're supposed to drain, but if they don't drain, they go bigger and bigger and bigger. And actually, they can actually get so big that they cause pain in your belly, or they can twist and they can cut off blood flow to your ovary. That's an emergency. So, you know, if you have that condition, we can actually make it so that cysts don't grow on your ovaries anymore. And that can save you from needing an emergency surgery. So, like, you know, if you ever hear someone saying like, oh, they're just on birth control because they like having sex and whatever, like, that person's ignorant, right? They don't, until they show you their MD or their DO, or that the fact that they're a licensed OBGYN, they don't know what they're talking about. And last but not least, guess what? Birth control actually reduces your risk of ovarian cancer. It reduces your risk of endometrial cancer, which is a uterine cancer. It's the most common type of women's GYN cancer that we deal with. And it also reduces the risk of colorectal cancer, one of the most deadliest cancers on the planet. Birth control pills actually reduce your risk of ovarian cancer by 50%. It's what we call the silent killer. It's a very, very difficult cancer to treat when you get it. And who would have thought that if you just take a pill a day, it would reduce your risk by half? That's amazing, but we don't talk about it. We just talk about how people, if we give people birth control, they're gonna have more sex, which is just silly. You know, that makes me, I was telling Dr. Dang this the other day. They're like, you know, I don't want to talk, you know, I don't want to do the HPV vaccine. People say that because I don't want to encourage my kids to have sex, or I don't want to do birth control because I don't want to encourage my kids to have sex. And I would say to them, does having airbags and seatbelts in the car make you drive dangerously? Right? Does anybody think that? I don't think so. So lastly here, oh, we need to go quick. I just wanted to go, here's a nice picture of all the different methods and how effective they are. So this is from the CDC. You can look it up, you can Google it. Just look up CDC contraception, and it goes over all the different types of contraception and how effective they are, meaning how likely you are using this method correctly to get pregnant within that year, right? What's the failure rate? Okay, so the calendar method. So I'm just gonna like tell you when my period is, and let's not have sex within those days. So just to let you know, sperm survives in the uterus, the reproductive tract, for 5 days. So if you have sex within 5 days on both sides of your period, you're gonna get pregnant, okay? So be careful, that's not a lot of time, right? You have to know that really well to use that method. The withdrawal method, 22% failure. That's actually kind of good. It's better than I thought it would be. But that's assuming you withdraw before you have pre-ejaculate, right? So if you don't and you have pre-ejaculate, that number goes out the window. We call that the withdrawal and pray, and I don't think it's a good method. Condoms, only 18% effective, a failure rate of 18%. That's kind of high. I want you to use them, and it's the only way to reduce STDs, for sure. But I wouldn't rely on it as 100% for birth control. But you look up here, the next row, things start getting good. The injection, we give it to 1 injection every 3 months. It's called a depot shot. 6% chance of failure in a year. That's really good. Birth control pills is 9%. The patch, you put a patch on, we have you hold it once a week. It's nice and easy. You can put it on your back so no one notices it. 9% chance. And the ring, the same thing. You put the ring in, you put it in, it goes in vaginally. It's a nice like rubber little ring, plastic. You don't even notice it. Your partner can't feel it during intercourse. 9% as well. And that can last, you can put that in for a month. Then we go to the very top, the very best, what I would recommend. So the implant. So that's called the Nexplanon. You put it in your arm. I kind of joked that if I were running a college, that I would have it be an opt-out for all freshmen to get one of these. It lasts 3 years. And actually, it is so effective. It is the most effective type of birth control that we have because it can't fall out. And it's actually more effective than tying your tubes. Look at the failure rate. It's almost nothing. An IUD is great. The Mirena IUD is, or levonorgestrel is the generic one. IUD, I love it. All the nurses I know, all my doctor colleagues all have it. It lasts for 5 to 7 years. It reduces your period. A third of people don't even have their period anymore. And it prevents endometrial cancer. So it's kind of like a win-win. If you don't want hormones, you can do the copper one. It lasts for 10 to 12 years. And your periods might be a little heavier or a little more crampy, but that's a really good deal. Like, let's say like you had your first kid, you're not sure, you might have another one, but you don't want to tie your tubes yet. You put an IUD and you think about it, let's think about it in 5 years, right? And then if you want permanent sterilization, you can tie your tubes, but look, it's not perfect either because sometimes tubes can grow back together by scarring effect. Or you can get a vasectomy. And actually, guys out there, or you can tell your male partners, vasectomies are super easy. You know, for me to tie your tubes, I have to put you to sleep, right? It's a whole day surgery, then you go home that day, but I have to put you to sleep. Vasectomy is just numb above the testicle, a little snip, and you're done. Super easy. And then in 3 months, your sperm, it takes 3 months for the sperm to not form anymore. All right, that's all I have to say. I'll take questions, and I might even stay like an extra 5 minutes.
Wow, thank you, Dr. Phung.
Real quick, I had some questions on your presentation.
Yeah.
I wanted to make sure I asked.
Yes. Should we go back?
Yeah, in terms of the HPV vaccine, is there, once you get it, is there any need for boosters after you get the full cycle?
Not right now. Not that we can tell. Okay. One series of 3 and you should be good. Okay. Make sure you get the 3 though. But some people just get 1. And then we don't know if that will last you for life. Okay.
And then also there was a question on, is there any work being done to find or screen in HPV in men?
There is. Yeah, there's a lot of work, especially in men who have sex with men. Yeah, but yeah, like this is kind of like, this is the elephant in the room, right? We're doing women's health, all these vaccines and trials were done for women, but who's the vector, right? Who's actually spreading it? It takes 2 to tango. So I agree with you that we need to pull men into this conversation more. Not with just HPV, but with reproductive, help with contraception. That's why I mentioned the vasectomy. This is not just a woman's responsibility. But I'll tell you right now, there's swabs of the neck and swabs of the throat, of the anus. I don't know of the swabs for the tip of the penis for HPV. But I do have a colleague that specializes in men's involvement in contraception, so he might not know more. His name is Dr. Brian Nguyen, also USC faculty. So something to consider.
Maybe we can bring him in to be
Oh,
one
yeah,
of our guest speakers.
He's pretty good. He's also Vietnamese, so more power.
Yes. I have a question, and this is, I just want to know, and I'm sure everybody here wants to know, why did you decide to become an OB-GYN or Ob Gyn? And, you know, what's the best part about your job and the worst part? Or what's the most rewarding and the most challenging?
Yeah, it's probably better. You know, in college, I was always very involved politically, and I always felt like I wanted to do something with like maximal impact. Like I wanted to fight a good fight. And actually in high school, I was like looking for a fight. Like I needed to find, there's not a lot of injustice in Laguna Hills, okay? I was looking for some injustice. But when it comes to women's health, there's not something more under attack and more controversial than women's health. And that is both the blessing and a curse in the sense that like I love advocating for the women and the transgender people. LGBTQ also falls under the purview of OBGYN, that we advocate for, the people that are like I said, that have higher health needs. And Dr. Dang talked about this, about everything that they have to go through, all the screenings they have to go through. They had the burden of childbirth. You know, and at the same time have nobody in power to advocate for them. They have men in Congress who have no medical background trying to dictate when they can see a doctor, who they can see, how far they have to drive, how many days they have to wait. In fact, you know, a lot of states say that they have to have an invasive ultrasound when they don't, right? And I think it's insane. And I joke with my other colleagues, I'm like, imagine if like an orthopedic surgeon, if Congress was telling an orthopedic surgeon that they couldn't do your hip replacement the way that they want to, the most effective way, or they couldn't use the materials they wanted to because some law was written that they couldn't do it. Why? You know, it doesn't make any sense. And the thing is that we're losing the fight. Abortion laws, birth control laws are getting more restrictive, not less restrictive. And the thing about it is that these, I talk about this to my students all the time. And do you know of the top maternal killers in the world? That means death during pregnancy and the 6 weeks following. The #1 cause of death is hemorrhage, bleeding after your pregnancy. That makes a lot of sense. The #2 is infection, and because you know this is the whole world, including the third world. But the #3 cause of death, maternal death, is unsafe access to abortion. Mm-hmm. Because people don't have the ability to access birth control, let alone an abortion, whether it is endangering their life or not. So what do? Just like the example I used before, if you don't let people have safe sex, are they not going to have sex? No, that's crazy. So what do people do when they don't have those access to those services? They go to sham doctors or they perform the abortions themselves. And this is not a what if. This happened in LA County in the 70s. We used to have whole wards dedicated to what we call septic abortion. People that become septic from an infection trying to self-instrument to abort their pregnancies. And now after Roe versus Wade, after we had the right to choose, the right to dictate what we do with our bodies as humans, there are no more wards for septic abortion in LA County. We don't see it anymore because that policy changed and it saved the lives of all those women that would have been affected by that. So that's what I'm fighting for. And that's why I feel so passionately about educating people about women's health. You know, like I said, sometimes people are like, oh, it's gross, it's weird. Even saying the word vagina is weird. But it is similar to the gay rights movement, right? The gay rights movement did not happen by gay people and lesbian people and transgender people and queer people doing it by themselves. They needed straight allies. The civil rights movement did not happen just because Black people were the ones that stood up and started saying, hey, this is messed up. It was white people that were allies with them that stood with them. And the same with women's suffrage in the early 1900s. They didn't get the right to vote just because they themselves said they needed equal rights. We've known that for thousands of years. It's because they had allies. And it is now the time that men became allies to women because they're under assault. And if you love your wife, if you love your mother, if you love your daughter, if you love your aunt, then it's time to stand up against the assaults on their rights. Because it's bullshit, right? They get paid less, they get fired more often, and then as soon as they get pregnant, people forget about them. So if you care about the underserved, if you care about the people that are less powerful than you, if you want to do something positive for people that actually need it, just look to the left and the right of you and look at the women that are in your lives and look at how by standing idly by not saying anything, you're letting the same status quo perpetuate. And that's the same issue with Black Lives Matter. It's the same issue. And we're allies in it, and we need to stick together.
Thank you, Dr. Phung, so much for your passionate statement. I'm going to turn it over to Dr. Dang. I'm so moved by everything that you've said, and I'm sure everybody here is as well.
So Dr. Phung, I had a question from the audience asking, why is it that people after the age of 50, why do they not get the HPV vaccine, or why is it not recommended?
Yeah, it's interesting. It has to do with it has to do with like cost benefit analysis, and that the number of people typically after age 50. Now I say typically, but you're not usually engaging with new sexual partners in a high risk way. Mm-hmm. But I've been surprised before. I told Irving and Lynn on Sunday when we met that I treated like a grandma, a Vietnamese grandma who was like 63, and she had an STD, and I told her I erroneously assumed that her husband was cheating on her, and she wasn't. She said that she had a new boyfriend, so her new boyfriend gave it to her. But it's just kind of one of those things with population size statistics. At a certain point, it's not effective to screen people anymore or give vaccines. So it's the same idea. After 75, why don't we recommend colonoscopies? Because it's not really going to improve their survival on a population size, and we have limited resources. So we can't screen everybody.
It's how it always is. You always got to weigh the risk, benefits, and the cost, benefits, and all that stuff. It's a fine balancing act in medicine. Dr. Phung, we had a question about something you said during the presentation. There was some confusion about the calendar method and whether you're trying to avoid sex during the fertile period. Could you
yeah.
talk about that
so
again?
Just so you know, just in case you're going to use this one day, all right? So let's assume you have a 28-day period, okay? So that means that you ovulate on day 14. That's what's typical for most people. Now I'll let you know that it's up to some people have a period every 21 days and some people have a period every 35 days. But what's consistent is the last 2 weeks, right? So if your period is, let's say your period is 35 days, so you're 5 weeks instead of 4 weeks, that means that the last 2 weeks is after you ovulate. So let's assume it's 28, just to make it simple. On day 14, you ovulate. When you ovulate, that means that egg can get fertilized. Because sperm live in your reproductive tract for 5 days, that means on day 9, if you have sex on day 9, when when you ovulate on day 14, that sperm meets that egg, you can get pregnant, right? So day 9, you can get pregnant. Day 10, you can get pregnant. Day 11, you can get pregnant. Day 12, day 13, day 14, you can get pregnant. Okay, now that egg is out. Let's say you haven't had sex yet, right? But on day 14, it's out. That egg can live for 3 to 4 days. So if that egg is still in your womb for 3 to 4 days, that means that day 14, you can get pregnant. Day 15, you get pregnant. Day 16, you can get pregnant. Day 17, you can get pregnant. Mm-hmm. So from day 9 to day 17 in this imaginary calendar, if you have sex during any one of those days, you can get pregnant. So it doesn't give you a lot of time. And it's not a very reliable method unless you are, like I said, counting it to the T, like I am. And it doesn't, you have to be kind of like systematic. Because what if you don't ovulate on day 14 and you ovulate on day 15 or 16? You don't know that. Some people have a varying ovulation calendar. That's why it's not reliable. Mm-hmm. Yeah, but that's how you would do it if you were going to do it that way.
Okay, thank you for that. And then I had a question. I had a couple questions about endometriosis. Would you mind answering some of those?
Sure, we can do that real quick.
All right. So, are there any serious problems or complications with endometriosis if someone is taking birth control to counteract their acne, or if they're not having sex? How could that affect someone's endometriosis?
Actually, birth control is a treatment for endometriosis. Mm-hmm. So we often will put people on it. So it has multiple benefits, and it can help your acne, your hair growth, and it can treat your endometriosis. Because endometriosis is an overgrowth of that lining of your uterus on different areas of your body. It could even be in your skin. By putting birth control on, it actually suppresses the growth of that lining. It's the progesterone. Progesterone is the hormone of pregnancy. So it's progestation, progesterone. So it actually thins out that lining and makes it less likely to grow and cause pain and bleed. So if you have endometriosis or you have signs or symptoms of endometriosis, you can treat that and actually suppress it so it doesn't cause that pain when you cycle.
And Dr. Phung, what about for a woman suffering from endometriosis? How does that affect her chances of having a child, and how does it affect her chances as she ages?
Right. So unfortunately, endometriosis is a large cause of infertility. Mm-hmm. Because the tissue that grow outside your womb, outside your uterus, can actually cause scarring of the tissues, including scarring of your tubes. If, like I said, if you are having issues with fertility, that it's important for you to be evaluated, because one of the first tests that we're going to do is test for tubal patency, meaning we test to make sure your tubes are open. Mm-hmm. And if you've had a history of very painful periods, a history of pain with intercourse, sometimes pain with bowel movements, these are all symptoms to us of endometriosis. And if we catch it early enough, we can make sure that the scarring does not affect your fertility. But if you wait too long, then the damage is already done. So that's why it's important to get checked in for that.
Okay. Thank you for that.
Thank you. Dr. Phung, I know you have to leave and you stayed over your time, and I just I'm sure we all here, we're so grateful for your expertise and for sharing your knowledge with us so we can make better informed decisions about our health. We will let you go, and we will definitely keep in contact. So thank you so much to you, and we're so grateful for you. And
thank you for inviting me. It was a pleasure, and I hope that you guys learned a lot today. And please don't be afraid to talk about this subject. Encourage your family members to go see their providers. I encourage my mom. I'm the youngest kid, and I told my mom, you got to go see your OBGYN, because when's the last time you got a pap smear? That was the last thing I asked her. You know what I mean? When's the last time you got your mammogram? Like, we have the knowledge, and we can't let people neglect their health anymore. If we truly care about our family members and our friends, we can't let them ignore their health any longer.
Thank you,
All
Dr.
right.
Phung. All
Take
right,
care.
thank you.
All right.
So
I'll see you
everyone,
guys.
yeah, I'll see you soon, very, very soon, hopefully. Bye, have a great day. So everyone, if you're still here with us, Dr. Dang and I will stick around for the next few minutes, and we'll try our best to answer as many questions as we can. We do apologize that Dr. Phung had to leave a little early since he has another meeting, but I hope that you found the meeting very informative, so you could make, you know, good decisions for you and your family and your loved ones. I did include a survey, so please do take the time to fill out the survey if you can. If not, I will email it to you. And I know we got some questions. So yeah, Dr. Dang and I are here. We'll hang out with you guys. And if you have questions, just shoot that in the box. I hope that all of the questions that you did submit on the form, the Google Doc that I provided, was mentioned in Dr. Phung's presentation. All
Yeah,
right.
we could, if there's some questions on the forums you want to
Yeah,
ask,
we do that
I
right
can,
now.
I can
Oh,
do my best to answer some of those.
I see someone here has raised their hand, so I'm going to go ahead and unmute you. You can ask us your question if you'd like. And
Yes,
thank you.
hello.
Hi.
Hi.
Go ahead.
I would like to ask you a question, and then I keep listening to Dr. Phung, and then he talk in length about women health, and then very interesting. So I'm a man myself, and then I just asked a question to Dr. Dang and you. That is, is it men have menopause?
That's a great question. Dr. Dang, can you answer that? Do men get menopause?
Men have menopause, so men do not go through anything that resembles menopause in a woman. For men, we can be producing viable sperm all throughout our adult lives. So that's why you can sometimes hear stories of men having a child at the age of 70, 75. So there is no physiologic equivalent of menopause for a man.
So maybe I think it is in a different form of menopause, because you see that this one we in real life, and then we compare apple to apple and orange to orange. But this one we compare apple to orange. I think man has menopause when they have decreasing testosterone, and then they decreasing libido. They feel the muscle mass is decreasing. They have more or less energy, and then they feel tiresome all the time and feel cranky, I guess. So I think that again we comparing orange to apple in this case.
Right.
Is that correct?
Yeah, it's really hard to compare because men do lose testosterone as they get older. However, even though they lose that testosterone, it leads to decreased sperm production and maybe even quality of sperm. That sperm is still viable, and you're still fertile even with that decreased testosterone. Whereas when women go through menopause, they lose that fertility permanently. So I think, yeah, it is kind of hard to compare the two.
Okay. Yeah, thank you. So I think we better look more into this. Thank you
Definitely.
for
That's
your
a
answer.
great
It's very impressive.
suggestion. Thank you so much for your question. All right, anybody else here? Do you guys have any other questions we could help answer? If anything, I can definitely ask Dr. Dang here a few questions that was submitted through our, let's go ahead and, yeah, let me go ahead and ask you this question that was submitted on our form. We'll stick around here for a few minutes. So one of the questions that was submitted was, is it possible to bleed outside of a normal period?
Yes, it is absolutely possible, and there are many reasons that could cause this. Some of the reasons could include starting a new birth control, could be infection, bleeding disorder, could also be hormonal imbalance, or it could be some kind of abnormal mass that's developing in that area, such as cervical or endometrial cancer. The one main concern is that if a woman is postmenopausal, if at any time she has abnormal bleeding, we would consider that to be endometrial cancer until proven otherwise. And then there's a lot of tests that we could do to help determine what is causing this abnormal bleeding, or bleeding outside of your normal period. You could do blood tests. We could check for infection. We check your hormone levels to see if there's an imbalance, because an imbalance in the hormones could cause your body to go through an abnormal menstrual period and cause you to bleed outside your expected time window. We can also do imaging with ultrasound, so we can see if there's any kind of abnormalities in the anatomy that could be causing this. I think I mentioned STI, so we would be checking for signs of infection, checking for chlamydia, gonorrhea, syphilis, trichomonas, like Dr. Phung mentioned earlier.
Mm-hmm.
We would also do a pap smear. Pap smear would help rule out cervical cancer, and we'd see if there's any abnormal changes there that could cause the bleeding.
Awesome, thank you. We had another question here. Why are menstrual cramps so painful for some females? And I could attest to that. What causes the pain during the menstrual cycle, and why do some girls or some females not have any pain at all?
Okay, so this is like, there's a lot of reasons why, but one of the main factors is this chemical called prostaglandin. It's actually PGF2 alpha. And this causes the uterus to have increased contractility and increased tone. So imagine like a muscle that's like constantly flexing. So that's one reason that causes this pain and discomfort. Some women just naturally produce more of that during their menstrual cycle. Some ways to treat that: you could do NSAIDs, you could do topical heat therapy, you could also take combined OCPs. Combined means the OCP has estrogen and progesterone. There's certain OCPs that have only progesterone. Those are not as effective in helping relieve these cramping and pain. You could also look into your diet too. There's been some research that shows certain foods that you eat could increase this cramping and pain, such as excess sugar, salt, fruit juices, excess fat. Even tea and coffee could lead to these painful cramps. And another thing is a lot of it is genetics. Some women, unfortunately, their genes just cause them to produce extra of this compound.
Wow, that's some great information. I'm really surprised because I think for some women, when we hear or when we get cramps, like they say, oh, drink tea, put a hot pack over your stomach so you feel better. Yeah, there's just a lot out there, so I'm really surprised that you mentioned not to drink any of that.
Yeah, the research has shown that tea and coffee could actually make it worse. There has been some other research that shows that a diet with a lot of vegetables can help reduce the symptoms of cramping and pain.
Okay, so I gotta eat your vegetables.
Definitely.
Okay, somebody here submitted a question. It says the pros and cons of teen vaccine for ovarian cancer. Is there such thing?
So I believe that person either mistyped the question or made a mistake, because there's no such thing for ovarian cancer. I think what they meant to ask was for cervical cancer. So to answer the question, there's no vaccine for ovarian cancer. As Dr. Phung mentioned, the only vaccine we have that can actually prevent cancer is the HPV vaccine.
Mm-hmm. And another question here, do you agree that we should be doing more as a country in terms of female health awareness, and what do you suggest we do?
Oh man, there's so much that we could be doing in terms of female health awareness. Even though we live in the United States, there's still so much more to do. In terms of education, there's a huge discrepancy in how much we call it sexual education you get depending on where you live. So I think that's definitely something that could be pushed more, like educating not just females but young teens on their sexual well-being. That's something that I think would definitely help a lot in terms of getting the right material out there and helping to prevent certain things from getting worse. So besides sexual education, what else could we do? I think we could do more things like MedTalks, where we have community programs that push this education, and also maybe opportunities for young students to shadow healthcare workers, because once you're in that environment, you're going to learn so much more than sitting in front of a lecturer. I think that's a great way to learn it. If you put yourself in that environment, it's going to be so much more interesting.
Yeah, that's a great suggestion. I have a question here that was just submitted to me. What are the pros and cons of the HPV vaccine?
So pros and cons of the HPV vaccine. The major benefit is that it will protect you from the HPV virus. Granted, there's several strains of the HPV virus, so the vaccine will protect you from some of them, not all of them. and why is that important? So if you get HPV, that's one of the leading causes of cervical cancer. So this vaccine will definitely help to protect you from developing that cancer, like Dr. Phung said. It's the only vaccine that has been shown to actually prevent cancer. So that is the benefit. In terms of cons, with any medical treatment, there's always going to be some kind of risk. There's going to be a risk that someone may react badly to it, or that it just may not work. However, you know, in medicine, you always got to weigh the pros and the cons, and oftentimes these treatments have their benefits greatly outweighs any risk. So hopefully that answers the question.
Thank you. I have a question here that was just submitted to me. It says, at what age should a teenager be concerned if she has not had her, I guess, her period? What tests or lab work should be done to overrule any potential medical condition?
Okay. So this is a question about delayed puberty, and delayed puberty is defined as no breast or pubic hair development in girls age 13. Now, in terms of menstruation, we generally don't consider it something to be investigated until a girl hits the age of 16 without hitting her menstrual period, or the first period, we call it menarche. So there's a lot of things that we can do to determine what is going on. One of the first rule, always get a pregnancy test. That's like one of the easiest things we can do to see what is going on. And also it helps us rule out. So if we know that you're not pregnant, we can move on with certain other tests where we may be hesitant if you are pregnant. So besides the pregnancy test, what else can we do? We can also take a look at your hormone levels. We will probably draw blood and take a look at your hormone levels and see if there's any kind of hormonal imbalance going on, because your menstrual period is regulated by your hormones. And in addition to that, we would also eventually consider maybe genetic testing. Maybe there is some kind of abnormality in your development when you were younger, or when you were conceived even. There's a lot of genetic mutations that could lead to a lot of reasons as to why a girl may not have started her period. In addition to that, we may also use imaging to see, does this female have the normal anatomy? Sometimes that could be during development. Sometimes something could go wrong due to genes or environmental factors that could cause her not to have the normal anatomy, and also to not have a period. Another thing is what they call imperfect hymen. We check and see sometimes the hymen is actually collecting all the blood and not allowing it to flow out. So that's another thing we would check too.
That's great information. I hope that answers your question. I have another one here. What age is too late for women to have children?
So that's kind of tough to answer, and because it really depends on the woman. At what age, technically, when you hit menopause is when it's too late to have children. However, every woman is different. And if a woman is older and she wants to have children, that's definitely something she should talk to her primary care physician about, or her OB gynecologist. Because every woman is going to have different risks, and depending on, every woman's going to be different, basically. So there's no one age when a woman is too old.
Thank you. All right. If anybody else has other questions, you are welcome to private message me, and I can ask that question to Dr. Dang. Or if you want to unmute yourself, oh, looks like we have a question. Okay, I'm going to go ahead and unmute this phone number. Unmute. Hi, go ahead and ask your question. I'm trying to unmute. Oh, there we go. Okay, hi, go ahead and ask your question.
Yeah, for the question, what age a woman can have children, and I want to add on, that is the maximum, I mean, no, not the maximum, but you see that the ideal age for a lady to have a kid is about like 20 plus. But the more you wait, the more risk of Down syndrome you have. And then for some professional reason or social reason or anything, if you want to have children late, and they always test for the amniocentesis for the Down syndrome and others also. So ideally, 23, 24, 25, 26, and that's the best time to have children. And then beyond that, it's okay, still good to go, but you have to be careful, and then especially test for trisomy, Down syndrome. Is it
Wow.
correct, Dr. Dang?
Thank
Yeah, definitely.
you.
As a woman gets older, her risk of having a child with genetic defects does increase. I have this table right here that shows for the risk of a baby with Down syndrome at the age of 25, it's 1 in 1,250 of having a risk. Once you hit age 30, it's 1 in 952. At age 35, it's 1 in 250. Now, for general genetic problems at age 35, it's 1 in every 192 pregnancies. That's the number of when we could expect something to occur.
All right,
And
thank you.
yeah.
Thank you. Thank you so much. That's great information. I have a question here from an anonymous person. They asked me, can you please talk about PMS and what symptoms are normal, and when should someone see a doctor?
So I'm not exactly sure if they're talking about post-menopausal syndrome or premenstrual syndrome. I'm gonna assume they're talking about post-menopausal syndrome. So when it comes to post-menopausal syndrome, there's a lot of things that happen in a woman that change when it comes to menopause, and some of those changes would be you're due to a decrease in estrogen levels, and that could have a lot of wide-ranging effects. So I think that, yeah, it's just such a broad question. There's a lot of things that happen because of the decrease in estrogen, in addition to loss of fertility. It could be they could lead to sleep disturbances. It could lead to mood changes. It could also lead to hot flashes, as we all know. It can also lead to genital urinary syndromes, and in addition to that, you could also have a loss of bone density too. So these are all things that could come along with menopause. Dr. Phung mentioned, your women are at increased risk of having osteoporosis and bone disease after menopause because of the decrease in estrogen. So that's those are just some of the things to be concerned about once a woman hits menopause.
I agree. That's really scary. I hope that answers your question. I'm going to take one last question here. This is from Ed. He asks, what are your chances for getting pregnant after 40? What are the chances?
So I don't know the exact number, but it, like I mentioned earlier, it all depends on the individual. Some individuals will still retain a great amount of fertility after the age of I'm sorry, what would they say, at age 40, right?
Age 40.
Yes, whereas other women, their fertility drops off significantly. And there is I believe there is a test you can take that might help indicate your fertility. I forgot the exact name of the hormone right now, but yeah, it's hard to say. Some people, it just depends on your genetics and your lifestyle. Some people retain their fertility for a while. Some people lose it pretty quickly, unfortunately.
Awesome. Thank you, Dr. Dang. And thank you everyone for being with us here today. We're so grateful for everybody for attending the program, and we hope that you found it informative. Yeah, so I would like to mention that, we do have a survey. I'm going to email that to you if you did get a chance to fill that out. We're really trying to collect as much information as possible. Reason is we want to take the survey responses and send it up to the Library Foundation and to the people up top to let them know, like, hey, this program is important. This is the type of program that people need in our community. And because of Dr. Dang and myself, this is the first time we're providing this program to inform all of you to make healthy choices for yourself and for your family.
Lynn, I had a question from someone, and I think this is a question that you could actually answer really well.
I hope I can answer it. Go ahead.
Someone asked are there any OB-GYN doctors on campus here at Penn State? I'm assuming the students from Penn State that they could see. Would you be
Yes.
able to help the audience in that regards? And not just at Penn State, but at all universities.
Yes, so all universities should have, when you are applying to be a student, everybody has to pay a healthcare fee or a healthcare cost in order to be a student because there is a student health center, and the student health centers do have gynecologists for you to visit. So I would definitely check with your student health center. Your school website should have that information. And if anything, I'm going to pull up Penn State's right now, I believe. Okay, so if you are here and you submitted a question about Penn State, I'm going to link this into the chat box. Oh, yay. All right. So I'm going to put that right down here. Thanks. Thanks, Ms. Smith. There's a student affairs office for health and wellness. They do provide medical services at Penn State. Contact your school, talk to someone. You're already paying the fees. You might as well take advantage of their services.
Definitely.
All right. Oh, yeah. Thank you, Jessica. She knows a lot. Yes, thank you.
Let's see. I have a question here coming in about what are some health concerns new moms should be aware of as they prepare for their baby. So there's a lot of things that new moms need to be concerned about. That includes infections, blood clots. Dr. Phung mentioned hemorrhages. There could also be issues with urinary and fecal incontinence because of the weakening of the muscles in that area. You could also have lowered libido. And another thing women should be concerned of is postpartum depression, which affects a lot of women. So hopefully that helps answer your question.
Okay. All right.
Well, I got a question from someone about yeast infections. What can you do to prevent yeast infections? So one of the things that a lot of people like to do is to douche the area. That can actually lead to an increased risk of yeast infections. So I would not recommend douching. Other factors that could lead to yeast infections are if you have diabetes, that excess sugar in your blood, that's going to get down to the vagina, and fungus love that. Other things that could lead to yeast infection are antibiotic use. Antibiotics are going to target a lot of the non-harmful bacteria in your body. So when you wipe out that normal bacteria, now you have free land for the fungus to invade, because that bacteria actually helps prevent fungus and bad bacteria from getting in. So what else could lead to yeast infection? Pregnancy could. Any states that lead to increased estrogen, obesity is one of those things that leads to increased estrogen production. If you use any kind of corticosteroids systemically, that could lead to yeast infection as well. Anything that causes your immune system to be suppressed, such as HIV or chemotherapy, that could lead to a yeast infection as well. And then what else? OCPs do have an increased chance of yeast infection if you wear tight-fitting clothing. And also, if you have a sudden increase in intercourse, that could also lead to a yeast infection as well. Right.
Thank you, Dr. Dang. And all right, I'm going to go ahead. It's already 5:30. I'm going to go ahead and conclude this program. I just wanted to let you all know that this program is being recorded, and we will make it available on our YouTube page. So I will speak with our PR person and hopefully get it uploaded ASAP. But if you haven't checked out our YouTube page yet, that's where we upload all of our videos. We also have our virtual career day series that we've been uploading on there, which has been really popular. Next week, we're going to be covering skincare. So we have a specialist that's going to be coming to dermatology physician assistant that's going to come and talk about how you can care for your skin. All right. Thank you everyone for being with us today. Dr. Dang, go ahead.
Please fill out the survey. It really helps us to know what we can do better for this program.
Yeah,
we're always
absolutely.
looking for ways to make the program better. So please take the time to fill out the survey. And
yes.
Thank you again for coming by for this session. We'll see you next time.
Thank you, everybody. Yeah, we'll see you next week on Wednesday at 4 p.m. with skincare.